Okay, so here we're going to look at some basic information and background on abdominal and low back training. So we're going to kind of take a section to kind of look at this region of the body because it really does kind of put into perspective some ways just to kind of organize your abdominal and low back training. What we'll do in class is focus a little bit more on like actual examples of specific exercises. So what I'm going to give you is kind of a framework to kind of start operating off of with this when you're kind of thinking about exercises, because there's different ways. And in particular, when you look at the low back, because there's such a common occurrence of low back pain, properly programming this could certainly not only just help that aspect of things, but just in general kind of help with performance. So if we look at the anatomy, what we're seeing on here is when we're looking at the kind of abdomen and low back area, there's a lot of individuals have kind of classified the inner core versus the outer core. So you'll hear people refer to the abdomen and low back as the core region, so the core of the body. Here we're looking at the inner core. Okay, so here you can see the diaphragm, the transverse abdominis, the pelvic floor muscles, and the multifidus. There's a lot of information out there on pelvic floor stuff. We're not going to get a ton into the pelvic floor in this class because it's a little bit beyond the scope of the class to address a lot of pelvic floor issues. But in kind of looking at this area, we see all of the direct sort of interactions with the spine and how important this is going to be to both health of the low back and just to posture in general. So we also clearly have like a posture. We have information on posture that we're discussing in class, but this is definitely something. So again, starting with the inner core, again, diaphragm, transverse abdominis, and the multifidus. All right, here we look at the outer core. And you can see in this picture, the transverse abdominis came up, but I kind of scratched it off so as people wouldn't get confused. But essentially what you're looking at here are the rest of sort of the more superficial abdominal muscles. So you have the rectus abdominis, the internal and external oblique. We're going to be talking about the posterior chain separately, but here we look at further the muscles on the outside that further support that area. And kind of one of the interesting things that we're going to be talking about later on. So one of the kind of best techniques used to sort of support the abdominal low back region is what's referred to as abdominal bracing. And abdominal bracing is essentially a technique. It's a fairly simple technique, but it is something that, sometimes people have a little trouble with kind of doing properly, but we'll talk about in class how to do it. It's also something that a lot of times is sort of like step one in individuals with low back pain in most instances. An abdominal bracing technique, as we'll describe kind of later on, is something that is very commonly used to help in managing that. So this picture is a little hard to see, but essentially what you're seeing on both sides of the body. So we talked about the inner core, the outer core. The other thing we're going to be talking about a lot in this discussion is you hear the term posterior chain. If you look at the picture kind of showing the back part of the body that we're looking at here, you see part of the posterior chain there. So the erector spinae, a little better picture of that coming up later. The other interactive parts with the posterior chain with the erector spinae, you'll have the glutes, and you'll also have the hamstrings are also a very important part of that posterior chain. Really within the posterior chain, it's the entire back part of the body. So we're not going to focus on we're not gonna really focus on a lot of the upper back muscles and stuff like that in this case, but really they're a part of that too. What we're really focusing kind of on here is a little bit more of the direct connection between the hips and the low back. So that's where a lot of the emphasis here with the hamstrings, glutes, erector spinae is a little bit more relevant. But in reality, when you do talk about the posterior chain, it's really the whole back side of the body, as you'll kind of see on the next slide that we're going to show. So here kind of is a little bit of a better breakdown, kind of showing the muscles in the back, more specifically those that kind of interact with the spine. So in functional anatomy, you didn't get a ton on the back muscles. We did go cover some things a little bit. What I would say a big thing to focus on in kind of looking at the muscles in the low back. If you look here, the erector spinae, okay, so this is that grouping of muscles that kind of goes completely up the back, and the erector spinae is kind of organized in segments. So if you're looking here, you can kind of see these muscles if you look at the picture. So I have the little highlighter, the little laser pointer set here. So the erector spinae consists of the iliocostalis muscles, the longismus muscles, and the spinalis muscles. And the way they're kind of organized, the iliocostalis muscles are kind of located the most laterally compared to the spine, and then going in. So you have your iliocostalis muscles here, your longismus muscles, and then your spinalis muscles. What's not illustrated on here too, which is also very important, it was shown in its part, it's actually classified as part of the inner core, are the multifidus muscle. The multifidus muscle is a segmental muscle that goes up the spine. One thing about the multifidus, and this is something kind of debated in biomechanics, is that the multifidus doesn't really have a ton of great leverage to produce movement. So some people view the multifidus as strictly just a proprioceptive muscle, meaning that it kind of just gives feedback in as far as the positioning of the spine. Again, that's kind of a debated notion, but it is there. One thing that is known about the multifidus is that in people with chronic low back pain, it is significantly atrophied, so that could kind of tell you something about that there. So this is clearly something to look at here. Another muscle that I do want you to make note of, and a lot of times it's because it's a muscle that does become sort of problematic, is what's known as the quadratus lumborum. So the quadratus lumborum is this muscle right here. It's not labeled in the picture, but this is a muscle that, as we'll talk about in the posture chapter, so when you watch your posture videos, this is a muscle that does have a tendency to become, very tight in individuals and overactive, and can be problematic in a lot of pain issues. Here's what I was actually talking about earlier, is that, again, the posterior chain really does encompass technically all the muscles in the back side of the body. Now, we're going to be discussing, not focusing a ton on these muscles, because, again, the focus here is going to be kind of on muscles and exercises that directly impact particularly the abdomen and low back. However, if you look at this picture here, you could kind of see, again, some of those important upper back muscles and kind of how they clearly, too, are going to influence things like posture and a lot of the movements, particularly in the upper extremity. If I had to point out another relevant structure here that's really important, if you notice this area right here, this is known as the thoracolumbar fascia. And in kind of managing a lot of the issues, whether it's posture issues, low back pain, whatever, the thoracolumbar fascia has a lot of muscles, and you can kind of even just see this on the picture that attach to it and interact with it, that again, clearly, it's again, we're not going to get into various types of fascial therapy in this class, but again, strengthening the appropriate muscles to kind of help in stabilizing the spine is clearly going to affect and impact this region of the body. Okay, so some considerations that we're going to have, and we'll explore these techniques and whatnot as a part of lab, and even as we're kind of going through some of the different exercises, particularly in the squat and really in the deadlift, we could have looked at this too, because bracing the spine when you deadlift is going to be really important. So again, review posture. So that discussion on posture that we had discussed, very important. Again, this area will kind of help support the lumbopelvic posture in the body and make sure for appropriate movement. The concept of breathing and bracing we're going to discuss, and maintaining, again, what we call neutral spine. So again, we always want to make sure that, again, the spine works best, particularly when you're kind of using it as a base of support for, particularly moving the extremities, producing power out of the hips and even up into the shoulders, making sure that that spine remains braced, and again, having appropriate mobility in other areas. So again, for instance, one of the big things that always comes up, I discuss this a lot, is, losing mobility in the hips. So if the hips, for instance, lose mobility, well, there's got to be movement that takes place still. So where the body's going to kind of, almost kind of leak into, particularly, is the lumbar spine, which again, the lumbar spine certainly needs a level of mobility. However, if it's having to become more mobile to kind of compensate for lack of mobility at the hips, that's going to create issues. So that's something that we'll also explore further in class. There's this concept known as the joint by joint theory that we'll kind of look at. In other words, there's some areas of the body that are, again, tend to favor mobility. There's areas of the body that favor stability. And as you go through those different areas, you could kind of see how you need to address, particularly when there's problems that are kind of very relevant, how to kind of manage that. Now, this is probably, in as far as just kind of understanding exercises with the abdomen and low back, the anti-movement classification, if you will, this is sort of your starting point, okay? So we're clearly not anti-movement because you have to be able to move, but what these exercises that kind of fall into these categories do is that they kind of teach as a base starting point to kind of manage really what this area is supposed to be. It's supposed to be a very strong base for your extremities to move off of. And I would even say, in the context of injury rehabilitation, so now I'm speaking from the standpoint of a sports medicine professional, that these kind of many times are the starting point when you're, not always, but many times a starting point when rehabilitating, for instance, a lot of your low back injuries. So what I'm going to do is I'm just going to kind of go over kind of what these classifications mean. What I want you to start thinking about, and I genuinely want you to do this, we're certainly going to go through some more, we're going to go through some examples, and I'll probably give some examples here, but what type of exercises could fall into it? Again, relevant anatomy is really important to be thinking about, and just from a movement perspective. So as we go point by point through these different classifications, so anti-hip flexion activities, okay? Anti-hip flexion activities would be activities or exercises that now focus a little bit more on that posterior chain, okay? So be thinking about exercises that, again, your glutes, hamstrings. So think about, if you're anti-hip flexion, you're primarily working on muscles that will do hip extension and also kind of manage even low back extension to a degree because of the close interaction between the hips and low back. So these would be exercises that address the glutes, the hamstrings, and the erector spinae from a stabilization standpoint, okay? So any exercise that addresses those areas of the body would be classified as anti-hip flexion exercises. If we move to anti-hip extension exercises, okay? Anti-hip extension exercises, so now we look at the opposite side of the body. As we talked about the posterior chain, this would look at the I didn't use this term earlier, but the anterior chain. So anti-hip extension, think about exercises that particularly stabilize the anterior portion of that lumbopelvic area. Okay, so your classic anterior chain abdominal exercises. would address anti-hip extension. Okay, so be thinking about exercises, for instance, that would work that anterior side, the abdominal muscles, both the rectus abdominis, the obliques, the transverse abdominis, um, and even also technically the hip flexors clearly. Again, a lot of times the hip flexor activity that you'll work on as a starting point, the hip flexors will be working more as a stabilizer for movements, okay? Not so much as a mover yet, okay? Again, we clearly don't want to make it that we never move any of these areas of the body, but this is kind of your starting point. So anti-hip extensions, then be thinking that anterior chain, abdominal muscles, rectus abdominis, the internal external obliques, and the transverse abdominis. Anti-lateral flexion. So here we're looking at the lateral portion of the body. Okay, so clearly a big part of the focus here will be on stabilizing, particularly with the obliques. And there will also be a lot of lateral hip interaction here. Excuse me. So a lot of the, pardon me, a lot of the lateral hip muscles, for instance, the glute medius, will kind of assist with these movements. So in the anti-lateral flexion, we think again your obliques and also your lateral hip muscles will have big interaction here. So basically things that would prevent. So for instance, if your obliques are stabilized, you're going to be preventing lateral flexion of the spine. And then the last one up here, anti-rotation. Again, this would have a real heavy interaction with the obliques. There's also erector spinae activity that goes on here. So here we'll be looking at exercises where your body's having to resist moving moving through rotation, okay? So in all of these situations, we're looking at stabilizing these movements. We're not looking at moving them yet. Okay, so clearly this would be looking at various bracing techniques and exercises that would prevent and kind of limit movement, okay, is what we're going to be looking at here. So so that's where we'd be looking at in as far as the various activities. So a lot of the exercises that I'm going to show you are going to be exercises where we're actually limiting movement to start, to work on the abdomen from a bracing perspective. So that kind of brings us into the idea of isolative core strengthening. So again, this is kind of the theme of this, and if we look at those anti-movement activities. So again, this is typically a good starting place, particularly for beginners or people who have dysfunction. It's also, I just think in general, it's good for athletes to incorporate, and I'll talk about ways, again, the big push in this class isn't for programming, but I'll talk about some ways that we could use these exercises. But I would even say for individuals who maybe even at the time have, healthy spines, people that don't have back pain or anything like that, at least not they're reporting now, that certainly there's options to still incorporate these things. They could be incorporated as warm-ups because they could help kind of enhance a lot of hip mobility rather, if they're really taught to kind of brace their spine. So some examples that you'd see here, for instance, are just simple things like your front and side plank activities would be isolative core strengthening. Bridging activities with the hips would be isolative core strengthening. So those are going to be a lot of the things that we sort of, focus on early on as far as like these core strengthening activities and activation movements. Now, the idea of integrated core training is where effectively you're now using your core kind of with your classic movements, okay? So these are, again, if you think about the activities that we've talked about already in class, okay? Because in reality, your core is supposed to brace as your extremities move. You want the better braced your core is, and in reality, you're Particularly in a lot of your bigger movements, your abdomen is very active. So we want to make sure that we're bracing as a part of this. So this is where now we're integrating the core into our actual movements. So your upper body push-pull movements, whether they're vertical or horizontal. Where this gets really kind of emphasized is in the lower extremity. So we've talked about the difference between your more hip dominant movements versus your quad dominant movements. So again, hip dominant movements being your hinging activities that we talked about, things in particular that are working that glutes and hamstrings. Clearly having a well-braced spine is going to be important for those because, again, we don't want a ton of movement and stresses going through the lumbar spine. So, again, think of particularly like a stiff-legged deadlift or a good morning, okay? So we're going to primarily be using the low back. The low back's going to be working really hard during those movements, but it has to be working more as a stabilizer with movement occurring about the hips to work the hamstrings and glutes. Even in your quad dominant activities, your squats, lunges, step ups, any of that, the abdomen being braced well, particularly for mobility like in a squat. The more the body tends to brace well at the spine, the more mobile the hips become. And that's even why we talk about a lot of these activities, and I'll discuss it, how they can be kind of utilized as a warm-up activity, because they can actually help to open up and allow for greater movement to occur at the hips. And as a matter of fact, that's actually been shown in research. If you just do simple bracing maneuvers, so by simple bracing maneuver, a front plank and a side plank, prior to hip mobility, it actually does kind of allow your hips to just be more mobile due to control at the central nervous system. In other words, if the body kind of knows that the spine's going to be braced, it kind of allows the muscles to naturally sort of allow the body to go through a greater part of the range of motion. So that's another way that a lot of that information could be utilized. So just to kind of wrap up, program placement, so how this can be used. Again, we don't do programming in this class, but so you could clearly, as I said, use this stuff as a warm-up, particularly a lot of your bracing activities. So again, you want to watch to a degree. You don't want to necessarily fatigue the area. So for instance, if you're starting your day with barbell back squats, for instance, you certainly don't want to fatigue the abdomen, but getting those muscles activated, again, can help to mobilize the hips. Again, stability movements don't tend to create a lot of fatigue because they're basically, a lot of isometric contraction going on, that those aren't quite as fatiguing. You can do that. You could even possibly put them between sets of primary movements. That's another thing you can do. Clearly at the end of a workout is another good area where they can be used. And I put up here, get use out of the Big Three by Stuart McGill. So Stuart McGill is a biomechanics expert who's done a lot of studies on the spine. He's basically constructed 3 exercises, and at least 2 of the exercises you've probably at least seen or heard about before. So these are 3 important exercises. So one of them is the side plank and variations of the side plank. Another one is what he refers to as the bird dog. Some people call them a Superman exercise, although I've seen, in my opinion, a Superman's another type of exercise that works the low back. But basically, the base for what's called the bird dog is the quadruped position, where you're on all fours. And you do various movements, particularly a starting point is alternating lifting your opposite extremities. So you're on all fours, you lift the right arm up and bring it into flexion, and you extend your left hip. And then you do the opposite on the opposite side. And there's various kind of modifications to that. So those are 2 of them. The third one is what has become known as the McGill crunch or the McGill sit-up. And what it effectively is, and we'll work on the technique of this in class because it's actually an exercise that, while looks easy, it becomes challenging for people to do. So the side plank, for instance, works kind of your anti-lateral flexion. The bird dog kind of works a little bit of anti-rotation and anti-hip flexion. The McGill crunch or the McGill sit-up is kind of your anti-hip extension movement because it's going to work the anterior, clearly the anterior abdomen. And it's a modification of a sit-up where it might sound a little weird to explain, but if you hear the explanation and then see it get done, you'll kind of see this a little bit better, where you lay on your back, you keep one leg straight, and you flex one leg at the hip and the knee. And literally all you do is curl yourself up, lifting your scapula up off the ground. So you don't do a classic curl up where you kind of round yourself up. If you think of the way you see most people do crunches, this is an exercise where you activate the anterior abdomen by literally just kind of lifting your upper body up off the ground. And again, I'll show you this in class. For now, just get the names down of what the big three is. And so this will here, when I do talk about it, you kind of recognize it and then can kind of absorb it that way. So this is that background information. So again, we'll follow up with this with activities in class. So if you've gone through this again, kind of in your head, have those exercise classifications as we talked about, because that'll be helpful as well, because then we can kind of get right into activities and working through those different movements.